Hello, I'm Dr. Brooke Patterson, and I'm here to talk to you about the physiologic changes in laboratory diagnostics in the elderly population. There are many functional and structural visual changes in older adults. Although vision loss is not an inevitable part of the aging process, age-related changes may contribute to decreased vision. Vision loss is a leading cause of age-related disability. However, visual impairment worldwide has decreased since the 90s due to an increased availability of eye care surgeries and health promotion. Visual impairment can impact a person's quality of life and ability to function. Daily activities like driving, reading, dressing, cooking, and other ADLs may be significantly impacted. There are many common eye diseases and disorders. There are different types of glaucoma, with primary open-angle glaucoma as the most common form. Primary open-angle glaucoma is mostly progressive and asymptomatic, resulting in visual field loss. This increases intraocular pressure and may cause damage to the nerve fibers. Cataracts are the result of oxidative damage and fatty deposits to the lens, causing blurring, glaring, and the appearance of halos. Cataract surgery is the most common surgery performed in the U.S. Diabetic retinopathy can occur in both type 1 and type 2 diabetes. It is characterized by increased vessel permeability. Blood and lipid leakage leads to macular edema and exudates. In advanced disease, new fragile blood vessels form and may hemorrhage. Early detection and screening is essential. Macular degeneration is the most common cause of new visual impairment among those greater than 50. It affects the macula, causing the progressive loss of central vision, leaving only the peripheral vision intact. Smoking doubles the risk, and there are genetic factors that contribute as well. Retinal detachment is a medical emergency that must be treated with surgery. Symptoms include a gradual increase in floaters and/or flashes of light. Dry eye is a result of decreased tear production associated with aging. Many medications can contribute, especially anticholinergics. Hearing loss is the third most prevalent chronic condition of older adults. It affects both communication and interaction, decreasing the quality of life. There are various types of hearing loss. The two major forms of hearing loss are conductive and sensorineural. Presbycusis is a progressive type of sensorineural hearing loss that is related to aging. There are different types of interventions to enhance hearing. Although hearing aids can be helpful, they can be very expensive and difficult to manipulate. In the elderly, the most common type of interference in hearing is cerumen impaction. When someone presents with hearing loss, it is important to first check for cerumen impaction as a possible cause. It can be removed through irrigation, medication, or manual extraction. Cochlear implants are becoming more common for sensorineural hearing loss. Cochlear implants bypass damaged portions of the ear and directly stimulate the auditory nerve. Tinnitus is also referred to as ringing in the ears. The most common type is a high-pitched tinnitus with sensorineural loss. Tinnitus usually increases over time and can be extremely irritating. As we age, the heart muscle ages as well, and the cardiac reserve declines. The heart valves may thicken and stiffen as a result of lipid deposits. Hypertension is the most common cardiovascular disease encountered in the elderly. The presentation of many cardiovascular diseases in older adults are different than those in younger adults. Most people with hypertension are asymptomatic. There are different guidelines published by various organizations and departments that establish guidelines for the diagnosis and treatment of hypertension. Coronary heart disease, or CHD, also known as atherosclerosis, refers to the hardening of arteries. A high-risk complication of CHD is an acute MI as a result of acute or long-term anoxia, which can cause damage to the heart muscle. In chronic CHD, the heart commonly attempts to compensate for damage through remodeling. Remodeling may lead to a decrease in pumping efficiency and/or cardiomyopathy. Another type of cardiac condition commonly occurring in older adults is atrial fibrillation. This condition may be completely asymptomatic, or it could cause issues such as falls, syncope, or even stroke. Heart failure is the most common cause for hospitalization, rehospitalization, and disabilities among persons older than the age of 65. There is left-sided heart failure and right-sided heart failure. The extent is determined by the patient's ejection fraction. Peripheral vascular disease includes chronic venous insufficiency, CVI, and peripheral arterial disease, or PAD. Symptoms of these conditions are pain, changes to skin, and decreased wound healing. With CVI, symptoms may include numbness and tingling in the extremities, or mild edema due to the pooling of blood with venous stasis. This long-standing stasis of blood leads to hemosiderin staining to the extremities. The overall goals of promoting healthy aging include minimizing disease risk, alleviating symptoms, delaying or avoiding end-organ damage, and maximizing quality of life. Age-related changes in the immune system include a decreased ability for defense against antigens, thereby increasing the risk for infection. There is also an increase in autoimmune disorders. Type 2 diabetes is the most common type of diabetes in the elderly population, and the prevalence increases with age. The classic signs of diabetes in both 1 and 2 are the 3 Ps: polyuria, polyphagia, and polydipsia. There are multiple complications compounded with comorbidities surrounding diabetes. Diabetes can lead to an increased risk of heart disease and tissue damage. Diabetics also have a higher rate of depression. Other complications include blindness, amputations, and kidney failure as a result of macrovascular and microvascular complications. Health promotion strategies include prevention, early identification, and glycemic control. The incidence of thyroid disorders, especially hypothyroidism, is increasing in frequency, especially in the geriatric population. Hyperthyroidism is less prevalent in those greater than 65. Thyroid disorders can significantly impact a person's quality of life. Although there are several signs and symptoms of hypothyroidism, including fatigue, weakness, weight gain, cold intolerance, depression, and dry skin, signs and symptoms in older adults are more subtle and vague. Normal age-related changes include lowered efficiency of gas exchange and reduced ability to handle secretions. Cilia that normally act to repel foreign substances become less responsive and less effective. Chronic obstructive pulmonary disease, or COPD, is most common in those greater than 65. It is classified by persistent and irreversible obstruction of airflow in and out of the lungs and includes emphysema and chronic bronchitis. COPD is caused from the inhalation of toxins and pollutants earlier in life, or in some cases, it is related to the deficiency of alpha-1 antitrypsin. COPD is encompassed with exacerbations and remissions. These symptoms require the frequent need for medication changes, hospitalizations, and respiratory support. In older adults, sudden altered mental status changes may indicate acute hypoxemia or hypercapnia. Asthma is an inflammatory condition closely linked to allergic variances and viral or bacterial infections. Asthma is both underdiagnosed and undertreated in older adults. A classic presentation is recurrent episodes of wheezing, dyspnea on exertion, shortness of breath, a non-productive cough, and chest tightness. Asthmatic symptoms are typically worse at night or early in the morning. Those with asthma are at a significantly higher risk for pneumonia and obstructive sleep apnea. Asthma can affect those at any age, but those with the highest mortality rate are older women. The nurse can help the older adult learn to monitor symptoms and educate them about the appropriate use of medications, oxygen, exercise modalities, and the avoidance of triggers. The normal range of laboratory values and diagnostics does not differ by age. However, the older a person is, the more complicated the interpretation. It is especially important to be able to identify abnormal lab values to ensure that the patient is treated promptly and appropriately. Hematologic testing includes blood and lymph and their component parts such as red blood cells, RBCs, white blood cells, WBCs, and platelets, PLTs. The primary function of RBCs is to transfer hemoglobin. There is no change in our RBCs with healthy aging. However, the speed at which new blood cells are produced in late life is reduced. The primary source of iron is the consumption of iron-containing foods, such as dark leafy green vegetables and red meat. Anemia is defined as a hemoglobin less than 13.5 in men and less than 12.0 in women. There is a reduced amount of RBCs and a decreased capacity for oxygen and carbon dioxide transport. Anemia is not a normal part of aging. However, it is a common finding, especially those with chronic diseases. WBCs protect the body from infection and other foreign invaders. They include granulocytes and agranulocytes. The different granulocytes ingest bacteria, allergens, and parasites. Agranulocytes include lymphocytes and monocytes. The lymphocytes are involved in cell-mediated immunity. Monocytes are the largest of the leukocytes, and they defend the body against foreign substances. Platelets are essential to clotting. With aging, the clotting cascade can be affected, causing more bleeding and bruising in older adults. The erythrocyte sedimentation rate, or ESR, is a helpful measure for the degree of inflammation, infection, or necrosis. It may be slightly elevated in many normal, healthy older adults. It is useful for monitoring several inflammatory diseases and treatment such as polymyalgia rheumatica, temporal arteritis, or rheumatoid arthritis. The C-reactive protein, or CRP, is produced by the liver during the acute phase of inflammation. The ESR and CRP are often used concurrently to monitor inflammation. Vitamin deficiencies are very common in older adults. These etiologies should always be considered when there are complaints of fatigue, delayed wound healing, anemia, or altered mental status. Folic acid and vitamin B12 are a part of the B complex vitamins and are essential to red blood cell production. Folic acid deficiency is more common in those with chronic alcohol abuse. Since vitamin B12 cannot be produced by the body, it must be obtained by high-protein foods. The ability to absorb B12 declines with aging, so adequate amounts must be substituted with a combination of foods high in B12 and supplementation. Those with decreased exposure to the sun are at higher risk for vitamin D deficiencies. Vitamin D deficiencies reduce the absorption of calcium into the bone. Important electrolytes to monitor are sodium, chloride, and potassium. The regulation of hydration and blood pH are critical for nerve and muscle function. Older adults are more sensitive to electrolyte imbalances. Electrolytes should be checked anytime there is an acute mental status change, medication adjustment, or increase or decrease in fluid intake. Hyponatremia in long-term care facilities is very prevalent. Hyponatremia can cause mental status changes leading to seizures. Hypernatremia is often associated with vomiting or diarrhea. Mental status changes are also expected in hypernatremia as well as weakness and lethargy. Hypokalemia is commonly associated with cardiac arrhythmias, muscle weakness, cramping, and confusion. Hyperkalemia occurs in people with advanced kidney disease, but can also be increased with specific medications, such as ACE inhibitors. In older adults, glucose should be strictly monitored due to the increased risk of hypoglycemia, which can result in confusion and a depressed mental status. Increased levels of uric acid are often associated with kidney stones or gout. Different situations can result in increased uric acid levels, including alcohol, medications, especially thiazide diuretics, surgeries, or acute medical conditions. The prostate screening antigen, or PSA, is a primary screening tool for prostate cancer. However, it can be elevated by multiple conditions, and its use is controversial. Creatinine kinase, CK, and troponin levels are cardiac enzymes often used as indicators of acute cardiac events. Elevated homocysteine levels may be associated with atherosclerosis and an increased risk for strokes, acute MI, and peripheral vascular disease. B-type natriuretic peptide, or BNP, is created by heart ventricles in response to excessive stretching, such as heart failure. BNP levels are often used to monitor the effectiveness of treatment in heart failure. Dyslipidemias and elevated levels of triglycerides have been found to be health risks and are major predictors of coronary heart disease. Lipid panels are usually conducted for the management of statin therapy. Serum albumin levels are most often measurements of nutritional status, but are also used to diagnose and monitor cancers, protein wasting states, and immunologic disorders in liver function. Prealbumin levels are a more sensitive marker for nutritional status. Blood urea nitrogen, or BUN, with creatinine are labs used to monitor renal function. Renal function decreases with age, but the body is able to compensate adequately, and there are only slight changes to laboratory findings. BUN is also used for monitoring hydration status. Reduced lean muscle mass in normal aging will result in a decreased creatinine level. Creatinine has been specifically used to diagnose and monitor impaired renal function. It is a more accurate reflection of renal health than BUN. It is very important to monitor therapeutic medication blood levels. For example, monitoring the INR in warfarin is essential to adjusting the dosage to remain therapeutic for clot prevention. Digoxin is a drug that is commonly used to control chronic atrial fibrillation. Monitoring includes periodic determination of blood levels. Urine studies are commonly conducted in the elderly population. With healthy aging, the findings don't differ by age, but abnormalities are frequently found because of the high rate of chronic conditions.